What is antisocial personality disorder and how does it affect people's lives? Antisocial personality disorder, or ASPD, is a serious mental health condition marked by a long-term pattern of disregarding others' rights, social norms, and the law. People living with ASPD may repeatedly lie, deceive, or manipulate to get what they want, often showing little guilt or remorse for their actions. It's important to know that ASPD goes far beyond occasional bad behavior or trouble with authority. This disorder is persistent, often starting in childhood or the teenage years, and can deeply influence how a person thinks, feels, and acts. Symptoms of ASPD often include a lack of empathy for others, an ongoing disregard for right and wrong, and impulsive or aggressive actions. People with ASPD might have difficulty forming honest, trusting relationships, and they may violate the rights or feelings of others without feeling responsible for the harm they cause. You might also notice patterns like irresponsibility at work or with finances, repeatedly breaking the law, or showing little concern for the safety of themselves or others. Because ASPD symptoms overlap with criminal or risky behavior, it's sometimes misunderstood as just bad or intentionally harmful choices. But it's essential to recognize that ASPD is a mental health disorder, not a lack of character, and that most people with ASPD need professional help to address their symptoms. Diagnosing ASPD isn't always simple, since people with the condition may not see anything wrong with their behavior or may be resistant to treatment. A diagnosis is typically made by a mental health professional using interviews, behavioral history, and standard criteria. Treatment for antisocial personality disorder can be challenging, but it's possible. Therapy, including cognitive behavioral approaches, is often a cornerstone of care, helping people learn more positive ways to relate to others and make healthier decisions. Medications may be used to manage symptoms like irritability or impulsivity. The most effective treatment usually involves a combination of therapy, medical support, and a strong commitment from the person receiving care. If you or someone you care about is struggling with antisocial personality disorder, don't lose hope. With the right treatment and support, meaningful change is possible. We're here to help. The Recovery Village Addiction and Mental Health Rehab Centers offer evidence-based, compassionate care from licensed medical experts, from medical detox and inpatient rehab to outpatient services. Call our recovery advocates at 855-239-9898 to find treatment that works for you. It's time to get your life back.